Now, before we get into the press conference speaker portion of the event, I want to share the BHA's land acknowledgement. We acknowledge that the BHA, whose facilities exist across the entirety of the state of Colorado, operates on the unceded land of the Arapaho, Cheyenne, Comanche, Eastern Shoshone, Jicarilla Apache, Kiowa, Osage, Ute Mountain Ute, Southern Ute Tribe, and others, past and present. We also recognize that many other Indigenous peoples also have ties to this land that were disrupted or altered by colonization. We honor and give gratitude to the land itself and the people who have safeguarded it throughout time. It's important for all of us to understand the long-standing history that has brought us to reside on the land and to seek to understand our place within that history. We commit to continuing to learn how to be better stewards of the land we inhabit as we continue developing relationships with all of its inhabitants. Thank you to our Equity, Diversity, and Inclusion Matrix team for creating this beautiful and thoughtful acknowledgement. Now we have quite a lineup of speakers today, including some from the BHA, partner agencies, and some folks with lived experience. A recording of the press conference and the Q&A session that follows will be posted on the BHA YouTube page after the event. A link to the YouTube page will be sent in a press release today. And speakers, you will be reminded when you have 1 minute left to speak with a countdown clock on your screen. I would now like to introduce our first speaker of the press conference, Lieutenant Governor Diane Primavera.
And I'm so pleased to celebrate the formal launch of the Behavioral Health Administration. As Lieutenant Governor and the Director of the Office of Saving People Money on Healthcare, I've engaged with and seen firsthand the great work that has gotten us to today. Since taking office, the Polis Primavera administration has prioritized the need to improve our behavioral health system to ensure that every Coloradoan has access to quality care when they need it. In 2019, Governor Polis directed the Department of Human Services to lead the charge on developing a blueprint for behavioral health reform through the Behavioral Health Task Force. And now, 3 years later, we can start putting that carefully crafted plan into action. With the Behavioral Health Administration, we can begin to rewrite the narrative for what it means to receive behavioral health care in Colorado. Early on in the Behavioral Health Task Force, we heard heart-wrenching stories from families whose loved ones had tragic outcomes due to the lack of access to care. We heard from individuals who had to drive hours to get to providers, wait weeks to get appointments, and not be able to find providers who accepted their insurance. We heard from advocates for people with intellectual and developmental disabilities about getting bounced back and forth between the IDD system and the behavioral health system and not getting care from either. We heard from the deaf community about the lack of access to providers who knew sign language, let alone being able to provide culturally competent care. We heard from tribal members who could not access care on tribal lands and could not access culturally competent care either, anywhere. So I want to personally thank everyone that came forward to share these intimate stories and trials with our team. Your voices have been integral to this process. It'll take another year to bring the Behavioral Health Administration to full operational capacity, but today is a day to both celebrate what we've accomplished so far while looking forward to the future. And I'm confident that the Behavioral Health Administration will continue to create more equitable and accessible behavioral health treatment for all Coloradoans. I'm grateful for this new beginning, and I'm confident that it will bring Colorado into a space that honors the integral connection between body and mind and makes care more accessible for everyone. Thank you.
Thank you, Lieutenant Governor Primavera. Now, the BHA's fearless leader, who is leading this history-making moment. BHA Commissioner, Dr. Morgan Medlock.
Good afternoon, everyone, and thank you to Stephanie, to our Lieutenant Governor. Can we just also just celebrate Jaleesa? I mean, that was just, I just feel free. I just want to thank you, Jaleesa, for helping us to get centered as we launch this fantastic event today. My name is Morgan Medlock. I am a crisis psychiatrist and an addiction specialist, and I am so honored to be the steward of your vision for the Colorado Behavioral Health Administration and to serve as commissioner. You know, when I was growing up in Dallas, Texas, and I watched my parents who are on the line today find a way, despite the fact that they were not mental health clinicians, they found a way to launch, to fund mental health resources for my community. And that's the lived experience that I bring to Colorado, seeing people who maybe didn't have the knowledge or the power, but they found a way to put resources to work for those who have been oppressed, marginalized, or simply set aside. And so Colorado, I want you to know that I bring the very best of my lived experience to this moment. But I also acknowledge that this is not just about an individual journey. It's not just about me and my family and where we've come from. It's about our collective story. It's about every person on this call. It's about every person in this state, our collective vision, our collective purpose, and our collective healing. So would you do something for me today? Would you put your name and the community you represent in the chat and just say this with us? I'm part of making history. Can you do that? I'm part of this. I'm part of making history. This isn't about some abstract idea. I am part of this. I see myself in the BHA. Would you mind just putting that in the chat? Your name, the organization, community you represent, and just say this: I'm part of making history. You're part of this. This is your BHA. Well, our story started on May 25th. May 25th, 2022 is the day that Governor Polis signed the historic Behavioral Health Administration legislation, which of course gave me the authority to remain a resident of Denver, Colorado, and to continue to serve you as commissioner. But it also gave us a platform for historic change. We stand on the shoulders of amazing leaders who have worked to push our system forward inch by inch for decades. And now the moment has come for us to seize this opportunity and to bring forth a behavioral health system that truly puts people first. And so we celebrate this moment today. We also celebrate our Lived Experience Council. Now, many of you know that I've been to over 40 stops across this state. And as we have engaged in the statewide tour, I promised you that our first action as the Colorado Behavioral Health Administration would be to establish the Lived Experience Council, because one of our values is doing this change with our community and not to our community. And so we are committed as the BHA to doing with our community and to sharing power. That's critical. Not just listening, but sharing power. And so I'm so grateful to, for the first time today, to publicly announce the new members of the inaugural Lived Experience Council. What a day. Representing the Southern Ute Tribe, Representative Stacey Overly. Can we just show that heart reaction? If you can go on your virtual reaction, can we just show some love for our Southern Ute Tribe and Dr. Stacey Overly, who will be representing that tribe on the council. Representing the Ute Mountain Ute Tribe is Miss Evelyn Lopez. Can we show some love for Evelyn Lopez? A resident of rural Colorado and a national trainer and speaker for the Opioid Response Network, our next appointee is Raquel Garcia. Jessie Pocock is appointed today to the Advisory Council. She's the Executive Director and CEO of Inside Out Youth Services. Our next council member is Noor Shafi. She runs a behavioral health nonprofit entitled Mentally Ill Kids in Distress. Our next appointee today is Seth Watkins. He is a peer specialist at Aurora Mental Health Center. Our next appointee is Ron Lee Liao, Mental Health in Chief at Children's Hospital, Colorado. Our next appointee is Ashley Anand. She's connected to Project Include through the University of Colorado. Our next appointee is Jamie Ulrich, Director of Weld County Department of Human Services. Next, we welcome Cameron Vigil, Rocky Mountain Engagement Manager for an organization called Young Invincible. Our next appointee today is Tasha Conker, peer mentor and a member of the Brain Injury Alliance of Colorado. Next, we welcome Bob Dorshimer, CEO of Mile High Behavioral Health Care. We also welcome Renee Anderson, advocate and volunteer for Forge Evolution Teen Court Program. Next, we welcome Raina Shaner, advocate against suicide and member of the Colorado Behavioral Health Task Force. Next, we would like to announce Catherine Washington. She represents the military as an Army medical personnel. Next, we welcome Tina Rowe, client advocate for Savista Health. And it was fantastic, by the way, to be out in Salida and to enjoy the opening of the new Savista Health Regional Assessment Center. Our next appointee is Carolyn Hall. She's one of our peers for our Rocky Mountain Crisis Partners support line. Our next appointee to our Lived Experience Council is Maria Martinez, board member for the State Injury Advisory Board for Colorado Department of Human Services. And finally, we welcome Rob Archuleta, Chief Innovation Officer of Crossroads Turning Point Organization. Can we show some love to all of our appointees for the first ever Lived Experience Council of the Behavioral Health Administration? I see our advisory council members getting busy in the chat. So advisory council members, jump in the chat and let the people know why you serve. Can you share your why in the chat? I was appointed to. We know that you were not appointed simply to attend a meeting. You were not appointed simply to listen to the commissioner. You were appointed to make history with us. So would you just jump in the chat and let the people of Colorado know I was appointed to, and we want to hear your purpose and your why. Oh my goodness, I am so full of joy today. People of Colorado, do you know that joy in itself is an act of resistance? We have survived 2 years of COVID. We have survived a behavioral health emergency. We have survived so many obstacles. We have endured 3.5 years of town halls, and here we are, incredibly resilient, incredibly joyful, ready to redeem the time and to make history together. And so we not only celebrate our Lived Experience Council, we also celebrate our people-centered values. If you go to our new website, bha.colorado.gov, and you click the tab About Us, you will see that our values reflect the stories that we've heard. Our first value is truth. The Behavioral Health Administration recognizes that in order to build trust, we've got to tell the truth. We have to acknowledge when harms have been done, and we have to be a source of change and not conflict. Our second value is equity. We believe that it is important to name racism and other root causes of injustice so that we can reallocate resources to support the desired outcomes for all people of our state. Our third value is collaboration. We believe in working with community and working across state agencies to realize a holistic, whole person behavioral health vision. Our fourth value is community-informed practice. And what that means is that, yes, we value best practices. Yes, we value the best of scientific data, but we also value lived experience. And our final value is generational impact. And people ask me, what does that mean? Well, we take it seriously in the BHA as leaders. We believe that the decisions we make today will make an impact 3 generations from now. And so we are taking meaningful action in order to create a new legacy. We not only celebrate our people-centered values, because values are no good if they're only on paper. Values must be lived by leaders of integrity. And so I'm so happy today to celebrate those who will be stewards of these values. Can I introduce our leadership team today? Please allow me to do that. It is no surprise that our Deputy Commissioner of Operations has a middle name of Hope. She has brought hope to this state in a powerful way. 3.5 years ago, she left her vibrant consulting firm. She stood out on the ground in the land of Colorado and chose to become an advocate for the people. Summer Hope Gathercole has indeed brought hope to this state. She has led the task force, she has convened the executive committee, and then she moved forward to amplify the stories of community voices across the state. Summer Hope Gathercole, I am so happy to partner with you to bring the vision of the people to life. She is our Deputy Commissioner of Operations. The next leader I want to introduce is Jamie Schaaf. She is our Deputy Commissioner for Equity and System Effectiveness. She was the leader who was chosen by multiple countries, agencies, leaders, government officials across the globe to amplify the voices of the experiences of the marginalized, the oppressed, those who have been set aside. She's worked with Doctors Without Borders. She has served in India, Ghana, Sudan, Pakistan. She was also the leader who was chosen to lead New York City through an equitable distribution of the COVID-19 vaccine. She has been named a top 40 under 40 public health professional in the United States. You'll be hearing from her later today. Jamie Schaaf, Deputy Commissioner of Operations. Next, I want to welcome our Chief of Staff, Andrew Rauch. He's an equity champion. He's a policy expert and a fiscal analyst. He joins us from the CDHS Benefits Division as our Chief of Staff. He will function as our Chief Strategic Officer to ensure that the Behavioral Health Administration is positioned to not only coordinate with community, but to coordinate cross-agency so that we all can work together to bring your vision to life. Our Senior Advisor for Children, Youth, and Families is none other than Christine Meyer. She comes to us with over 15 years of clinical experiences and a dedication to amplifying systems philosophy and trauma-informed care so that 3 generations from now, we will have more resilient children, youth, and families. Our Chief Financial Officer is Stephen Pang. He is a national consultant on behavioral health finance reform. He has helped states such as Massachusetts and California and Delaware and Kentucky build accountable, affordable behavioral health systems. And lo and behold, he's a resident of Colorado. Thank you, Stephen, for being our Chief Financial Officer. Our Policy and External Affairs Division Director is none other than Ryan Templeton. We welcome him today. Ryan began as an addiction counselor at WellPower Clinic, and he began to see how system gaps impacted patients he was serving. And so he began to look into policy and systems work. He grew to become a policy advisor for the Office of Behavioral Health. And now we are so glad that he is the Policy and External Affairs Division Director for the Behavioral Health Administration. Ryan is special. Ryan has memorized every statute in Colorado law that has to do with behavioral health. If I ask Ryan in a meeting, Ryan, where does it say that? He can quote it chapter and verse without even blinking. It's phenomenal. We want to introduce Joy Hart today as our Division Director of Statewide Programs, Innovation, and Technical Assistance. Joy comes to us from the Department of Corrections, where she is the Chief Behavioral Health Officer responsible for the delivery of services to those who are justice involved. As you know, across this country, we are still grappling with the legacy of trans-institutionalization, where unfortunately, inadequate investment in community resources has led to the movement of people from institutions such as hospitals to, frankly, homeless shelters or jail. But Joy is the leader who, for the past decade in Colorado, has ensured that those who are justice involved receive care with dignity and respect. And I'm so glad to have her in the BHA as our Division Director for statewide programs. Welcome, Joy. And finally, I want to introduce Kristen Lara. She is our Health IT Director, and she believes that tech products that are produced within government should compete with the best of commercial products. And so later I'll be telling you about a new application we're going to be launching later this month, thanks to the leadership of Kristen Lara. Welcome, Kristen. We not only celebrate our values and our leaders, but we also celebrate new ways for the people of our state to access behavioral health care. Less than 3 months after the passage of the historic bill establishing the Behavioral Health Administration, we will be rolling out our first offering, which is the Care Directory. Listen carefully. The goal of the Care Directory is to provide a public-facing, searchable directory of behavioral health providers closest to you. This will work much like the Yelp application. You will be able to search for services and providers. You will be able to use a guided search to identify best fit resources. You will even be able to narrow your search by criteria such as location, hours, language support, payment accepted, and more. The soft launch of this visionary application is July 5th. That's when we will begin our quality assurance and testing process. And the hard launch for your use of this application will be July 26th. We also celebrate today the launch of 988. 988 will be the new 3-digit number to call, text, or chat that connects people to the National Suicide Prevention Lifeline. On July 16th, 2022, we in Colorado will join the rest of the United States to begin using 988. We recognize that crisis system improvement doesn't happen overnight, and we want to ensure safe, immediate connection to local resources and support. While Colorado works to build 988 staffing capacity and address technology concerns, we will continue in our state to promote our state crisis line. Again, that number is 844-493-TALK, or you can text TALK to 38255. So again, anyone who lives in Colorado, please continue to use the in-text Colorado Crisis Services line to be connected with support and local resources. Again, that's 844-493-TALK or text TALK to 38255. We also celebrate today the continuation of the I Matter program that provides free therapy for every youth in Colorado. And folks, this is just the beginning. We have completed a year's worth of work in just 6 months, and we are committed to bringing your vision to life because we believe that all people in Colorado deserve to experience whole person health. And we envision a whole new world in which behavioral health services are accessible, meaningful, and trusted. Therefore, it is our mission with you to co-create a people-first behavioral health system that truly meets the needs of all people in Colorado. Thanks for being here today. And with that, I want to introduce our tribal liaison, Shelly Solopal. Welcome, Shelly.
Thank you so much, Dr. Medlock. That was absolutely wonderful. Let's see if I can follow that. I hope everyone could hear me okay right now. And I'm really glad everyone out there is here. So greetings to the audience and all the people listening today. I'm so glad you're here to help us really step forward into what I think is a new era. My name, as she said, is Shelly Solopal, and I'm the tribal liaison for the new Behavioral Health Administration. She, her, hers, and I'm really very happy to be a part of this. The values that Dr. Medlock spoke of, truth, equity, collaboration, community-informed practice, and generational impact resonate really deeply for me, every single part of that. And if everyone would just, work with me here a little, I would love to tell just a tiny story. My dad was American Indian, Little Shell, Chippewa, and my family is from Montana, just to give you some context. He was the first person to attend college in his family, at least on that side. And he told me once that after he had finished college, you'd think he'd be real happy, he had gotten depressed and was having a lot of nightmares and whatnot. He had this young family, couldn't sleep. So he went to a psychologist. And this was quite a while ago. The psychologist said, geez, what you need to do is you need to write down your goals on a piece of paper as like homework. So he goes and he diligently does that. And he writes down his goals and he comes back the next week And he tells them, hey, I think I'd like to get an additional type of degree and work in public health. And maybe I can help people that live in poverty, people, you know, like the family he came from, and that have lots of diseases and die young and whatnot. Maybe he could improve things. And the psychologist looked at him and he said, well, you did this wrong. I meant for you to write down realistic goals. This is like pie in the sky. That will make you more depressed. So he told me that he never went back to another mental health professional from that moment on. He went to ceremonies now and then, and I do think that was somewhat helpful. So I'm glad about that. And I know racism itself is really only one part of this problem, and that's probably not the most, you know, traumatic or perfect story. But gosh, it resonates with me because it goes across generations. To me, it affects everything, like what you do with your life, how people have seen you, whether that system helped you, your parents, all the stories before you. Then you have that experience. I mean, you can live with those issues till the last day of your life because of that interaction. I really think that our leadership, our staff, all the providers out there, we have what it takes to really begin to address these issues and build something good. And that's why I feel happy to be here. The values that form this foundation, those are rock solid. And working with communities and their real expertise in life, I believe we can make systems of care that are for everyone. And so with that said, I appreciate the time to speak, and I would like to go ahead and introduce Katya. Katya Morkichu. I hope I said it right. Katya, who is both young in age and wise in wisdom. Was it right, Katya?
Morkecho.
Morkecho. I'm so sorry.
It's okay.
Thank you. You may take the floor.
Alrighty. Thank you, Shelly. Good afternoon, everyone. My name's Katya Morkecho. My pronouns are she, her, hers, ella. And I'm the youth coordinator for Healthy Transitions Grant. And I want to thank you all for being here with us at the BHA launch, Behavioral Health Administration. It's going to take a bit to get used to that new acronym, but we'll be okay. I'm honored to be here and more excited to share with you all like the incredible stuff my team is looking forward to accomplishing. Given that I only have a few minutes to talk, I want to focus on how the BHA, our new launch and our rebranding is, being committed to being for the people, by the people. I'm very excited to continue expanding the work young adults across our state are doing. Hold on. The goal of Healthy Transitions Grant is to increase access to mental health and other supportive services for unsheltered youth, unsheltered youth that are transition age, that being 15 to 25, maybe a little bit younger. This is both an incredible and vulnerable population that we really hope to uplift. I'm thankful that we are really shifting from previous practices in which we excluded the populations we were serving from being at the table. We as young people are actually aware of our needs. And as young adults, we're the subject matter experts on the youth perspective. And getting to facilitate a youth panel for Colorado Crisis Line was a really awesome experience, and it's a very clear example of ways in which we value lived experience of young people. It's also important to hear what changes our Colorado youth want to see. Their feedback creates an opportunity for truly impactful change. And over the weekend, I was brought to tears while presenting at Pride event. I heard from young people how the Colorado line had saved their lives. And that to me was like, it was like the first time getting to see this in person. I'm often very much behind the scenes and don't get to do that one-on-one kind of interaction. So it was really awesome to hear that from young adults. And their stories really reminded me of why I'm passionate about youth empowerment and youth engagement. So as a healthy transition age youth crew, we created a process for youth consultation to step away from tokenizing our young adults and to have a more inclusive population of young adults as well, providing impactful feedback for, now the BHA. As we continue to improve mental health access and services for unsheltered youth and young adults across Colorado, I look forward to making sure young adults at the BHA have an authentic, that young adults have an authentic relationship with the BHA, that there's transparency, and that we follow the motto of nothing for us without us, nada para nosotros y nosotros. And if you agree with that, could you type that in chat and add nothing for us without us. I want to just quickly thank Dr. Medlock for all the awesome work she's doing and for really supporting youth engagement and hopefully supporting hiring more young adults in the future. And I want to thank the adult treatment and recovery team, as well as my healthy transitions team. I would not be here without you guys. Thank you so much. And now I will be introducing Kevin Neiman. I hope I got that right. Department of Human Services, Director of Policy and Legislative Affairs.
Yeah, thanks a lot, Katya, and thank you for your words today. I'm always inspired when I hear you testify or speak in meetings, and it gives me a lot of joy to hear your involvement in the process of building out programs and systems to ensure that the voice of young Coloradans is not only heard, but taken into consideration when decisions are made. So thank you very much, Katya, for your words today. And thank you to the Behavioral Health Administration's new leadership team taking their seats today in their new positions. It has been an honor of my professional career over the last few years to work on legislation aimed at bringing us all here together today. It has just been wonderful to see all of the ideas come to fruition and really set a foundation for great things to come over the next few years. So when I think about the Behavioral Health Administration, it's interesting to me when I think about what am I most looking forward to with the launch of the BHA, and because there's so many things. So I'm going to take a small detour here for a moment into the bureaucratic weeds, but I'll make sure that I keep it at a high level here, though, even while meandering into the weeds a bit. One of the first things when we started working on legislation to bring forward the Behavioral Health Administration, specifically what its duties would be, one of the things that really stuck out to me was that there weren't really definitions or necessarily concrete standards that could be applied across the state when it came to what it means to be a behavioral health provider. There were pieces here and there in statute, there were pieces here and there in a regulatory or a rule structure, but bringing them all together so that everyone, whether you live in the Denver metro area, Colorado Springs, Durango, Meeker, Lamar, Sterling, doesn't matter, or all points in between, there weren't really those standards that were articulated in statute as to what is defined as a safety net provider. And I know that sounds a little bit bureaucratic as we talk about safety net provider and regulatory and law and statute and things. But here's the key about that. We want to make sure that everyone, regardless of where you live, if you live in those communities I mentioned or anywhere else, receive access to the same type of care and same services, and that groups that are providing those services as partners with both private sector providers, nonprofit providers, as well as state funding providers, making sure that they're all adhering to those same guidelines so that whenever you or your loved one go in to get service, they're meeting those standards. And I'm really pleased to see that the Behavioral Health Administration is well positioned with staff and with law to be able to do that. I think that's going to be an immense benefit to the state as we move forward. The Department of Human Services, we are thrilled as the continued operator of the state's two mental health institutes, as well as the forensic system, to partner with the Behavioral Health Administration. We've had wonderful relationships so far to make sure that all of the efforts, whether it's before folks arrive at a mental health institute or a justice scenario, or on the back end when they're transitioning out, we want to make sure that those services are seamless to the families and individuals that need them. So CDHS, we are extremely grateful for the opportunity to partner, and we look forward to seeing all of your future successes. With that, I'm going to introduce a colleague of mine from another department, and that is Kristen Bates. And before I turn it over to Kristen, I want to introduce Kristen as she is the interim director for the Medicaid program for the Department of Healthcare Policy and Financing. But Kristen's also has been a tireless champion for behavioral health and the needs of individuals seeking behavioral health services. And she's also been a very patient and kind teacher in sharing all the knowledge that she has and bringing that into legislation and regulatory and policy discussions. So with that, Kristen, I'll turn it over to you.
Thank you so much, Kevin, for that warm introduction. I want to say good morning. Hello, everybody. As Kevin said, I'm Kristen Bates. I am use she, her, hers pronouns, and I am the interim Medicaid director for the Department of Healthcare Policy and Financing, which is our state's Medicaid agency. Colorado's Medicaid program, which is called Health First Colorado, covers more Coloradans than any other health plan in the state, more than 1.6 million people, or about 1 in 4 Coloradans. Like a lot of you, I do this work because I'm personally committed to leaving this world a better place than I found it. And I think one of the most important ways that I can help do that is by working towards a simple goal: timely access to quality behavioral health care. And so that's why I'm so honored to be with you all today in celebration of the Behavioral Health Administration. Today is so momentous. It is the first day down this transformative path to a new tomorrow for all Coloradans. And I just can't thank Dr. Medlock and the team enough for all of their work that they've done. Even though this is the first day of the BHA, there's been a lot of work that's brought us here. Public programs like Medicaid serve the people with the highest behavioral health needs. These are the state's most vulnerable, often marginalized populations, and Medicaid is the largest payer for services. We have over $1 billion that we spend on behavioral health services every year. So looking at the scope and breadth of our Medicaid program of Health First Colorado, it's going to be just so essential that we work very closely with the BHA on identifying and working to improve gaps and improving opportunities across the behavioral health system. Fixing things that we really know need to be changed, like health disparities, challenges to access care, workforce needs, quality care improvements, and payment inconsistencies. The only way we can do this, the only way that we can transform the system is if we work together and make sure that we work across all of our state agencies with our state, local community partners, and with the people that we are serving. So for this, and for the Medicaid members we serve, we are here, we are all in, we are a fully invested partner in this crucial work. As Kevin mentioned, some of the projects that really I think are some of the most essential that are coming out that we're partnering on right now have to do with expanding and strengthening our behavioral health safety net system. That's the providers and services that are available to those who receive funding through public agencies. Through the bill that created the Behavioral Health Administration, we are literally redefining what a behavioral health safety net system looks like and what it means to be a provider. These new laws are vitally important to modernize and transform the system that has been relying on definitions that came from the 1960s and are simply no longer meeting the needs of our citizens. The new changes will make it easier for small and medium-sized behavioral health providers to treat Coloradans with low incomes. It will also help hold state providers accountable to standards around member access, quality, and that is a really foundational element of what the BHA will be doing. We know that it's going to be hard. Transformation requires that we all make changes, and the short-term changes are hard, sustained improvements are hard, but that is why the BHA's oversight is going to be paired with sustainable payment models that we're going to partner with them to build. And that's why it's so important. We have to make sure that we are able to meet, that for providers who are able to meet the standards of safety net, that we can reimburse them and get them paid properly. The new definitions allow for some providers to meet some additional standards, serving the most vulnerable, providing better quality, and then they are allowed by doing that, better rates, receiving priority grants, priority for grants and expansion projects, and participation in some value-based agreements. We are already working to do this through a couple of programs, including a universal contract that's going to streamline our contracting with providers and make it easier for us to pay providers, and through payment models that help improve patient health. So the Department of Healthcare Policy and Financing is thrilled to join hands with the BHA in creating a better tomorrow for Coloradans today. It's been a really long road. We've, like we said, many years, 3 years that we've been working on and listening to communities and building plans and blueprints and outlines. But every milestone was worth it to get here. So now we celebrate the creation of the BHA, which will focus all of their time, all day, every day, on improving behavioral health systems and cross-agency collaboration here in Colorado. We're so excited to be able to evolve our Medicaid behavioral health network to improve care management, to integrate and advance payment policies, to get better data analytics, reporting systems, get more federal money out into the system by using our Medicaid dollars, and to achieve shared goals that elevate healthcare and outcomes for all Coloradans. You know, listening to Katya and some of the others has me really remembering some work I did very early in my career around patient empowerment, where I used to lead patient empowerment trainings through a Robert Wood Johnson Foundation program. And one of the things that always stuck with me about those programs was this idea that your doctor, your provider, they might be an expert on bodies or on minds, but you are the expert on your body and your mind. You actually know more than your provider about what it's like to live in your shoes. So I am just thrilled and inspired by the way that the BHA is committing to ensure that people with lived experience will continue to be a part of this work, will continue to be a part of building a system that works for them. And I want to thank all of you on this call and all of those who've worked the past few years to make that possible. So with that, I'd like to introduce another amazing partner in this team, and that is Jill Hunsaker-Ryan, the Executive Director of the Colorado Department of Public Health. Jill is the kind of public health leader that we absolutely love around here. She's a foundational support for behavioral health work and does the really important job of connecting data, people, and policy. So with that, I will turn it over to Jill.
Thank you, Kristen. And I'm glad Kevin recognized all of your amazing contributions to our state as well. Wow, I am so excited to share in this historical accomplishment. And Dr. Medlock, you are the right person at the right time to lead this new agency. I also want to congratulate our sister agency, the Department of Human Services, for their hard work in standing up the BHA for the people of Colorado. At the Colorado Department of Public Health and Environment, we recognize how important a person's mental health is to achieving optimal physical health and well-being. We work on the prevention side of things to create the conditions in which people can achieve their optimal health, and we know the BHA will continue to be our partner in this endeavor. We also provide behavioral health entity licensing, a function that will be moving to the BHA to help consolidate quality behavioral health care oversight. We're very excited to have this new agency in our state and believe it will help make our behavioral health system more effective and accessible to residents. The Department of Public Health and Environment is ready and eager to help in any way and with anything that you need. Thank you for the opportunity to speak to you today on such a great occasion. And with that, I'm going to turn things over to Summer Gathercall, the very talented Deputy Commissioner of Operations at the Behavioral Health Authority. Summer.
Thank you so much, Dr. Ryan or Director Ryan. And I know that the BHA will be working very closely with public health and environment in the years to come. You are, of course, the prevention experts and thus a member of our extended family. And we know that working together, we can really help to elevate prevention and move upstream to help ensure that people get the help that they need even faster. So hello, everybody, and welcome to our celebration. I am so excited to be here with all of you. As Director Ryan said, I am Summer Gathercall. I am the Deputy Commissioner of Operations for the Behavioral Health Administration, and I go by she, her, hers. I have had the ultimate privilege of being involved with this work since the very beginning. In fact, it was actually exactly 3 years ago on July 1st, 2019, that the Governor Polis's Behavioral Health Task Force came together in Douglas County for the very first time. And over a period of 15 months, 150 people came together to develop recommendations to ensure that we actually have a system that works for all Coloradans. Countless others came forward and shared their stories and their experiences and gave us ideas and suggestions for what we need to do better. And here we are today. Dr. Medlock mentioned earlier our advisory council, and I am so excited for that group because I have to tell you, that is the group that's going to hold our feet to the fire. That is the group that's going to celebrate with us as people are able to get quality, timely access to care. And that's the group that's going to say, hey, there's still problems and we need to figure out together how we're going to solve them. Dr. Medlock mentioned earlier some of our new values that we have established. And I want to talk to you a little bit about the value of collaboration and what it means to me. So I'm going to ask you to indulge me as I tell you a quick story. A little over a year ago, we brought almost 80 everyday Coloradans together from across the state. All of them had intersected with our behavioral health system in one way or another. Some of them had used it personally. Some of them had tried to help their friends and family gain access to services. And, just again, everyday Coloradans. And we went outside of our usual circle, worked with some unusual partners, and were able to include people in this group who had not typically been included before. So of course, our first meeting was virtual because of COVID. And after the introductory remarks and the level setting and so forth, we actually broke into groups that people were able to self-select by how they identified themselves most. And I sat in one of the groups, and of course we did introductions and we shared a little bit of our story, and we started talking about care coordination. The real purpose of bringing these 80 everyday Coloradans together is to help figure out what does care coordination need to look like in Colorado. So we had that conversation, and then at the end of that group meeting, there was a gentleman who said, and I need to quote this because it was so important at the time. He said, "I've had so many challenges with getting help. This is the first time that I've ever been asked for my opinion. It's the first time that I've been with a group of people who can really relate to me. It's the first time I've been invited to this kind of group, and I feel heard and I feel respected. And I haven't felt this good in a really long time." And that embodies the spirit of our value of collaboration. Yes, we need to partner with providers and hospitals and schools and counties and law enforcement, and I could go on and on. But mostly it's about partnering with those who can help us design the system that works for everyday people. We have to working with community, not to community, as you heard earlier. And I just want to give you a side note to that end of that story. That group continued to meet over a couple of months, and one of their ideas that they put forth was a regional hub for care coordination, which if you look at our historic bill that passed earlier this year, that's exactly what we have. We have regional entities or hubs that are responsible for care coordination in Colorado starting in July 2024. That is what this group of everyday Coloradans made happen. And I want to make sure that that kind of work continues here in Colorado. So another thing that I'll just share, and many of you have heard me say this already, about what I'm most excited about is that it's happening, everybody, it's happening. We have been having this topic of conversation for years. There have been, in the last couple of decades, dozens of reports that have been written about what do we need to do to transform our behavioral health system. And I'm so fortunate and I feel so grateful that we have a governor Governor Polis, who has made this a priority, our legislature who has made this a priority, and our stakeholders who have said, yes, this needs to change. I want to tell you one other thing that I'm most excited about, and I'm going to nerd out here a little bit. So I'm the former Secretary of Labor for Washington, D.C., and one of our biggest priorities and one of the biggest investments that came out of the last legislative session was really focusing on addressing our workforce shortage in Colorado across our behavioral health field. This is my jam. One of the reasons why I'm so excited about this is because, when the task force was meeting, we heard from so many people who unfortunately shared that they had harmed themselves because they had to wait so long to get an appointment to get help. We heard from people who said that they stopped looking for help because they couldn't find a provider who looked like them, who could communicate with them or was from their community. So addressing the workforce shortage is one of the biggest priorities that we have. And we've been charged by the legislation that was passed to make sure that we have a plan in place to address that by September 1st of this year. We are looking at how do we increase the number of behavioral health professionals in the state. We're looking at how do we improve our cultural competency of our workforce. We're putting together a program to promote behavioral health and then establish programs that offer advancement opportunities so people can get their foot in the door and then continue to move up. We're creating an online system that will allow people to acquire all different kinds of training. And this will result in people being able to access services in a more timely fashion and also experience higher quality care. So I mentioned that we have a plan that's due on September 1st. And I have to tell you, I am not exaggerating when I say that implementation will begin on September 2nd. We know how dire this is and how quickly it needs to be addressed. You've heard a lot of people talk today about how we want to make sure that people are able to access quality care. And one of the ways that we're doing that, and I think you heard Kevin Neiman talk about this a little bit earlier, is that the BHA is working across all of the different 13 state agencies that touch behavioral health funding or programs or both. And we are setting expectations for all of our providers. We're setting standards, and we're all agreeing across all of our state agencies that these are the standards that we are going to hold everyone in our system to. We're setting standards that regardless of where you live in Colorado, what your need is, what your situation is, that you're able to access services that you would feel comfortable saying to a friend, you should go here. That's the type of system that we want to have in Colorado. So I mentioned just a couple of things that I'm really excited about. One last thing I want to share is that when I've asked others what they're most excited about, the word that I have heard time and time again is hope. For the hundreds of Coloradans who shared their stories about the heartbreaking experiences that they and their family members have had with our behavioral health system, this is pretty significant. For the first time in a really long time, there's hope and belief that our system is going to change and that's going to happen. And as you heard from Dr. Medlock earlier, hope certainly resonates with me because it does happen to be my middle name. And I too am full of hope for what's to come. So I want to share a quote with you real quickly from Jonas Salk, who's a medical researcher who developed one of the first successful polio vaccines. And he said, quote, "Hope lies in dreams, in imagination, and in the courage of those who dare to make dreams into reality." It is the everyday people of Colorado who have guided and helped and worked to turn our hopes and dreams into a reality. I look forward to the day in the coming years when we hold public testimonies again and we hear the positive stories from people and families who have used our behavioral health system. That is my hope, that's my dream, and I challenge all of us to continue to make it a reality. So now I'm super excited to introduce my counterpart, Deputy Commissioner of Equity and System Effectiveness, Jamie Schaaf. She is a psychiatric epidemiologist. You heard from Dr. Medlock earlier that she has worked all over the world. I could go on and on about her credentials and how smart she is, but I think the most important thing that I would want you to know today is that she just has this beautiful soul that exudes warmth and happiness to all around her. So I'm so excited to be able to work with her. And Deputy Commissioner Schaaf, I will hand it over to you.
Thank you so much, Summer. It is such a pleasure to be here and to be working with you. I also have so much hope, and it has been so clear since the day that I started that this is such an incredible team, really. It's really an incredible team. Folks who've been working really hard in partnership with communities, really practicing what we preach. So I am so excited and hopeful that we'll continue to develop thriving communities. So good afternoon, everyone. Thank you so much for joining us on this momentous occasion. As Summer mentioned, I'm Jamie Schaff. My pronouns are she and they. As a psychiatric epidemiologist, I have a background in leveraging data to design, implement, and evaluate behavioral health programs in partnership with diverse communities. Over the course of my career, I've had the opportunity to work with communities who've been experiencing devastating humanitarian crises. From that, I've carried with me the value of participatory action methods, sharing power with communities to create appropriate and relevant solutions, and generating community-informed data to complement traditional data streams. To achieve behavioral health equity, as we have heard and agreed today, we must truly practice nothing for us without us. And I'm thrilled to join the state of Colorado to work in partnership with our advisory council and communities to transform our behavioral health system. So many of us here today are here because we have lived experience, ourselves, our families, our communities. Today, so many people have been navigating the devastating impacts of the COVID-19 pandemic, economic challenges, and unstable environments. Many have lost the social support networks and places they would typically go to support their own personal wellness. Others have experienced disruption in routines. And as we emerge from the long and potentially traumatic acute phase of the pandemic, it is clear that the behavioral health needs of people across the country, and really the world, are many. We've heard from previous speakers today about the growing need to meet the behavioral health needs for people throughout the state who may be living in unsafe environments and communities. As we launch the Behavioral Health Administration, I aim to work together with partners and communities to ensure that we continue to move towards accessible, inclusive services and connect folks to safe and supportive communities. We have a challenge as we continue to live through the pandemic and transform our systems to ensure behavioral health is part of the new norms. The challenges we face are not new. Many have been highlighted by communities for years. And this is an opportunity to demonstrate to people in Colorado and to all of you that you have all been heard. We are centering our approach on people and ensuring we continue to listen and respond to the people served throughout Colorado. This is essential. There is great wisdom held by people who have experienced the behavioral health system. And as we approach this from the perspective that all people in Colorado should have equitable access to high quality care and an opportunity to achieve wellness. Together, government agencies, community organizations, and communities can transform the system and support opportunities for people to achieve optimal wellness. Also, in a time of increasing connectivity, we must also remember that not all people in Colorado have the same access to the tools needed to access telehealth and remote care, and that's a challenge that we must take head on. As we identify opportunities to support and serve all people in Colorado, we are witnessing systemic change in practice. Together, the Behavioral Health Administration and our communities will work across government, entities in partnership with community organizations, communities, and people with lived experience to transform the behavioral health system. Achieving behavioral health equity will require cross-system collaboration, and we look forward to collaborating with all folks in Colorado to effect systemic change. We are continuing the work of many who have been challenging norms and routine practice, and I thank you all for partnering with us on this journey. I'll now pass this back to Commissioner Medlock, a visionary and inspiring leader who is centering our everyday work on people and achieving generational change. Thank you so much.
Well, thank you so much, Deputy Commissioners Schaff and Gather-Cole. People of Colorado, you have now heard from all state agencies that are engaged with us in this work. I want to just highlight a timeline of what you can expect going forward as we position ourselves for our Q&A period. I'm seeing some questions in the chat, so I hope this will be clarifying. In terms of provider engagement, absolutely. Providers, you will be at the table. In fact, we have our second crisis providers convening on July 8th. You need to be on that call. We are going to be talking about how do we imagine crisis care for this state. I will also be engaging with all CEOs of community mental health centers. to talk about how do we move into the future to provide a people-first behavioral health system. But our second crisis convening is this month, July 8th. That's next Friday. Remember that we will also be launching our care directory July 26th with a soft launch on July 5th. Those are big dates for July. In August, what you can look forward to is the first public meeting of the Lived Experience Council. We do believe in transparency. Someone has asked that in the chat. Remember that our first value is truth. We believe in communicating transparently and accurately with the people of Colorado. In fact, we chose that value because as we traveled the state and did our brand survey, all Coloradans agreed, 97% of people, that truth needs to be the first value of the BHA. So certainly we are committed to truth telling. So the first meeting and public testimony period for the Lived Experience Council, we will be launching that in August. August will also be another big month for the Cabinet Council. Remember that the Behavioral Health Administration bill grants me as commissioner the authority to convene all state agencies for the purpose of realizing a holistic vision. So the first meeting of all cabinet agencies to discuss you, to discuss people, to discuss how we build a people-first system will occur on August 3rd, and we will continue meeting the first Wednesday of every month to put in place your vision. September, here's what you can expect in September. In September, Wendy Zimmerman, our workforce policy officer, will be releasing the first ever behavioral health workforce development strategy. I'm seeing a lot of folks in the chat asking, hey, if we create services but have nobody to provide the services, where will we be? Well, you are exactly right. We know that we are not the only state in a behavioral health crisis. And so on September 1, you can expect the BHA to release our workforce development strategy. It's important for us to build capacity, but we also need to build cultural humility within our workforce. And so over the next year, we will also be building out a learning management system where individuals can learn equitable and anti-racist approaches to providing behavioral health care. October, what can you look forward to in October? Well, besides my birthday, you can look forward to the first time that I will be going before the General Assembly to give our first look and glimpse at our strategic vision. That's another important date, October 2022. I'll be going before the Assembly. You can hold me accountable there for how we are implementing the vision that you have put forth through the task force and our Lived Experience Council. All right, December, the next big month. In December, we're hoping that now the advisory council would have met for 5 or 6 months. We would have had our interagency cabinet convening, and we will be able to actually release to our entire state the Behavioral Health Administration strategic vision. That is an outlook for the next few months, and we hope that you can continue to track our implementation process by going to bha.colorado.gov. If you click implementation dashboard, it's all transparent in terms of the next steps we're taking. Thank you, everyone.
Thank you, Dr. Morgan Medlock, for those remarks there right before we get into our Q&A. I'll wait until I'm queued up. All righty. So again, thank you, Dr. Morgan Medlock. Now we have our Q&A session. And we got some questions in the chat already. So we have been recording those with names, names and your questions all written out. So what I'm going to do now is call on those people and say their questions as they came in. And then Dr. Medlock will answer them or throw them to someone else to answer them so we can get them answered, or we'll save them for later if they need to be answered at a later time. So I'm going to pull up now. My computer was being a little weird. Okay, our first question came from Amy Smith. Amy Smith, are you still here in the chat with us? Assuming Amy is still here. Access, her question was, access is not the only issue our public system has. I asked here to hear from the critical voice appointees, folks with rights, POV, anyone who knows and understands the scope of serious issues uncovered in the CO Lab series. Since no one responded, I must ask, Was the critical voice screened out? Are there any appointees representing those harmed or those whose rights have been violated? If not, I feel strongly you are on the same path of reform efforts that the state and industry has been on before. True reform cannot be achieved without these voices. Amy, if you are here in the chat with us, if you can confirm that that is in fact your question. And Dr. Medlock, if you would like to speak to that question.
Sure, thank you for the question. This is a new day in Colorado, and we have followed the statutory guidelines for establishing our new lived experience council. I would be hesitant to discredit anyone who has been appointed today to our advisory council. Their experiences are powerful. Our equity team selected them based on their lived voices. And so I am actually very hesitant to discredit this board and this council that has been established and the council that was advocated for by the Behavioral Health Task Force and by most people of this state. So I stand with our council. I stand with those who were selected and appointed, and I believe that they will hold us accountable as a behavioral health administration. In addition, there are clear statutory guidelines for who can sit on the council, and so we can send you the BHA bill for further reference, and we have followed that as a guide. Thank you so much for the question.
And now, Dave Perry, I do see your hand up, and that's exactly how we would like this Q&A to go after we get done reading off these written questions that have come in the chat before we started the Q&A session. So Dave, we will get to you and any others who have questions right now after we're done reading the ones that we already received in the chat. And next I have Andrew Rose. Andrew, looks that you had a few questions here. I'm reading 4. Would you like me to read all of these, or would you like to come off chat and present them yourself, Andrew? See Andrew unmuting. Fantastic.
Oh, thank you. And thank you for the opportunity to ask questions. This is an exciting presentation. I look forward to partnering with all the actors in this world of behavioral health. My name's Andrew Rose. I'm the policy advocate for Combine. We organize Medicaid providers that contract with the RAEs. Our concern is that the BHA potentially has control over 18% of Medicaid spending, while healthcare policy and finance has control over 82%. As Kristen Bates said, that there's $1 billion spend here. Our particular concerns are, like Summer referenced, the workforce. We saw a reduction in the workforce after the RAE that manages our area cut our rates 20% in January of 2020. So we have firsthand experience with the rate management, and we have particular concerns around transparency. Transparency, of course, is a high value for the BHA. So my first question would be around gag orders in the contracts between the RAEs and the providers. Currently, the contracts between the RAEs and the providers say unconscionable things like, we can change your rates at any time. They say you may not discuss your rates with other people. And they also force us into individual arbitration. So my first question is, how is contracting and the universal contracting going to change that status quo?
Hey, Andrew, thanks for your question. The universal contracting provisions that are established in the Behavioral Health Administration bill actually have a launch date of July 1, 2023. So we are yet a year ahead in terms of initiating those universal contracting provisions. Actually, in just a few days, Healthcare Policy and Finance and the BHA will be signing our first formal agreement about how we will move forward with problem identification, transparency, and our first in the nation access to care methodology. No state has actually been successful in figuring out a way to measure access to care cross-payer, and we are looking at ways to deploy that for the state of Colorado. We will be the first state to accomplish that. So yes, we are certainly committed to transparency and working with healthcare policy and finance. And I'm really excited about our formal agreement with HCPF as they move forward. If Kristen Bates is on the line, do you have anything to add to that particular answer?
Thanks so much, Dr. Medlock. Yeah, I think that there's a lot of changes that we're going to be moving forward with. And one of the things that we really want to do is work with the BHA to set some standards that go across providers and across our intermediaries, like the regional accountable entities and the new intermediaries that are going to come out of the BHA called the BHA'S. So as we work with those processes, I do expect there to be changes in methodology. And what the universal contract is supposed to do is try to hold standard on what is it that we're measuring, what is that we're rewarding, and what we're incentivizing. Mr. Rose, obviously there's a lot of technical questions that you had prepared, and I'm happy to follow up with you afterwards. But from an overarching perspective, we see the universal contract as a ways to be more standard across our RAIs, more standard across the BHA'S, and have a shared and transparent version of what payment methodologies are being used for the different provider types.
Thanks, Kristen. Stephanie, who's up next?
Yeah, Andrew, we all good there? We answered your question? Okay, so next we have Geno, G-E-N-O. Hope I'm pronouncing that correctly. One question. Oh, sorry, that's not exactly a media question. I think that we already cleared that one up, asking about website handles and things like that. So next we have Matthew. 2 or 3 questions here. Matthew, I'm happy to read the questions, or you can come off mute and let us, if you want to come off mute, let us know in the chat, and our Zoom text will take you off mute. Let me know.
I can talk about that. So I'm a Medicaid member currently with Colorado Access, and I've had lots of concerns about transparency because I don't have access to knowing the difference in pay rates because I'm having issues with potential parity issues and access to care. But I've also even asked questions like, what is the rate of approval for different prior authorizations? And I've been told that that's proprietary. And I feel as a member that that kind of information is very important. And I'm also really interested in the website's transparency because I've already had to put complaints against Colorado Access website for being unethical. Just the way they have it, and a lot of how you guys explained the new app sounds almost identical.
Hi, Matthew. In terms of transparency, if you go on our website to our implementation dashboard, soon we will actually be launching our project plan. As you know, the Behavioral Health Administration has 2 years to become fully operational. Despite all the wins we announced today, we're only 20% operational. This is just 20% of us at this time. However, if you go to our website, bha.colorado.gov, and you click data and performance, there is then an implementation dashboard there. We have an initial PowerPoint presentation that shows our approach to issues like contracting, et cetera, some of the other questions you've asked. And we will soon be adding the full project plan for the next year and then the following year for us to become fully operational to that website. The care application you mentioned actually was built by people with lived experience. So they would say that it is transparent and that it is people-centered. I'll pass to Kristen for comment on the Medicaid question.
Yes, thank you. Matthew, I'm not familiar with the specifics of Colorado Access's website, but if you have some insight into how care coordination websites and provider lists can be improved, I'm sure that you can share those with us. And I'll put my email in the chat if you have some specific things that you would want to follow up on around the rates of utilization management. Utilization management is the term that we use whenever we are trying to basically balance the budget that we have so that we can maintain one of the strongest benefits in the state, right? We have a lot of things that we do cover, but in order to cover all of these things and to have the flexibility that we have within managed care, there are limits on what we're able to fund. And so if you'd like to reach out to me, I'd be happy to follow up on those specifics around what prior authorizations are needed. We did pass a bill this year in the legislature that shows we're no longer doing any prior auths on psychotherapy outpatient. So if it's related to that, hopefully that's something that we have addressed.
Right, and next we will call on Dave, who has had his hands up for quite a while up in the corner. So Dave, we invite you now to come off mute or to type in the chat your question.
Very much. My question is about the directory, and it sounds like you're going to step this up pretty quickly. In short order, the public is going to be able to access some kind of information to find out what's available in their area. I wonder, is there going to be a reverse side of this? Is your agency going to do some kind of inventory or census or registry so that there's an understanding from your side as well as from the media what's available in a region? And I wonder how people would get on this registry. An example that we've got here is there are numerous governments and sub-governments that suddenly are adding providers, mental health and behavioral health providers onto their staffs, or they're budgeting for those positions in the next year or two. And I wonder if your agency is going to be monitoring that to understand what's available in a certain region outside of what's being reported to you from the agencies that you're already working with.
Absolutely. There was a key bill this session called the Continuum of Care Grant Program, where we will be standing up a county assessment tool where county commissioners and leaders can tell us by county where the gaps are in the system. And then we obviously need to do a feasibility study to determine how we fund and fill those gaps. But in terms of the specific question on the application, I actually want to invite, can we put the spotlight on Deputy Commissioner Summer Gathercole? Summer, can you tell us a little bit more about the application and how the people of Colorado will be able to give feedback on this application?
Absolutely. And, I'll start just by sharing, Dr. Medlock shared that we will be rolling out the application later on this month. Over the next year, we will be adding bells and whistles to make it even a more enhanced application, and so that people can really use more criteria to search what they're looking for. We are working really closely with, a couple of different databases, not just to ensure that the data we have is correct, but to also ensure that the data that we got around providers are providers who are actually accepting new applicants, new patients who are open to, to seeing new people and setting appointments. And eventually that will be something that will also be done by the application. So Dave, I'm happy to follow up with you offline if you have specific ideas that you want us to take into consideration around how we can make sure to be adding new professionals who are seeing new patients. We would love to have that conversation with you.
Okay, cool. Thanks.
You got it.
And now we will take Tasha. And Tasha, you can either come off mute and chat with us, or you can put your question in the chat.
I'll come off of mute. Here in El Paso County, our co-responder, mental health co-responder program for the state, I have come to recently find out that El Paso County is now like one of the biggest counties in El Paso in our state, and we only have one co-responder. How are we going to, what is like your guys' direction on how to implement that co-responder unit that we have for behavioral health and law enforcement?
Thanks so much for the call again next Friday. We are actually trying to reimagine crisis services for the state, where any person in any county, whether rural or urban, can be assured of quality services. As you know, SAMHSA actually promotes the use of law enforcement only if needed to maintain safety. Actually, best practices is to send a peer or a trained behavioral health therapist. So we are going to be talking to our crisis providers, who will all be on the line next Friday, July 8th, as we talk about the new Medicaid benefit for crisis, and also how do we align with SAMHSA best practices. We're here for you. as you know, I'm a crisis psychiatrist. This is bread and butter for me. This is really what I care about. And as we build out a meaningful continuum of care, we know we have to have a strong front door. I'm glad you're on the council.
Thank you, Tasha. And I do want to say we did compile a list of questions that were in the chat before we got to our Q&A. I think now what'll work best if everyone who had a question can raise their hand and we'll answer them that way. It's just a little clearer for us on our end. And with that being said, I will now call on Robin. Feel free to come on.
Nurse Robin, come on, come on, Nurse Robin.
That's right. Nurse Robin here to serve you guys. Thanks for having us on today. This is wonderful. I'm glad I didn't miss it. I thought I had missed it. But the question that I had was, I've been on the website and I didn't see a spot on there for the community organizations that are working with everyone. I need to know, was there going to be something up there? You know, the Colorado Council of Black Nurses has their initiative going for those who are incarcerated to get better jobs, to decrease their recidivism, and the mental health that goes along with that. So I was needing to know, are you going to have that on your website or did I just miss it?
Nurse Robin, we can do that. Maureen is on the line. She's our brilliant comms director. We'll figure out how to do it. We do have the tab where we show our statewide tour. And of course, we've been all around the state and highlighting and making videos with various leaders. But you're right, there needs to be something more meaningful. So we will be meeting with your organization on July 17th. Actually, Jamie and I have a Sunday meeting scheduled with you. And yes. So let's talk about how we have an equity-centered website. Let's talk about that.
Sounds good. I'll be looking forward to it. All right, thank you.
So you all know why I call her Nurse Robin, because everybody just uses, you know, the doctor term for doctors. But I think if you're a nurse or any other title, you ought to be acknowledged. So that's my joke with Nurse Robin. Good to see you, Nurse Robin.
Thank you, Nurse Robin and Dr. Medlock. Next, I'm going to call on Bailey Johnson with her hands up there. Bailey, if you can either come off mute or you can chat us in the chat your question.
Hi, yeah, thank you so much for this opportunity. I'd just like to, and I apologize if I missed it, I wasn't able to hear the whole meeting, but I'm just curious about how interdisciplinary teams can become more involved with these efforts. I think I'm an occupational therapist, and most of the barriers that I've seen to having more of an impact with this population is because Medicaid doesn't reimburse me to see an adult with a psychosocial diagnosis. They have to have a physical diagnosis. So that's been a real problem for everyone in my field who is passionate about working with this population and filling the gaps within creating opportunities for independence, safe independence, assessing cognition, and really kind of building a bridge between the physical health and the mental health piece. Is there any initiative to make more of a combination between like the physical diagnosis codes and the mental health diagnosis codes and allow us to more seamlessly work together as interdisciplinary teams?
Thanks for the question, Bailey. I think you're getting at the heart of, you know, what it means to be people first, that we don't try to divide people based on their challenges, that you go through one door for physical health, another door if it's an addiction issue, and a different door if it's serious mental health challenges. So absolutely, this speaks to our vision of being a people first behavioral health system. And yes, there are some dollars that came through this legislative session for supporting our academic centers and integrative work. And I'll be happy to have you come and work with our Lived Experience Council on how we can improve there. But yes, we want to support that.
Thank you for considering it.
Yeah, and if I could add to that, sorry, this is Kristen from the
Kristen, let's get the spotlight on Kristen
from Medicaid. Yeah, I mean, I will say that this is a tall order. I think one of the ways, there's a couple ways we could go around this. but I think that the integrated care planning is one of the best ways that we can do that, doing integrated models of care with multidisciplinary teams. As of right now, there are limits to what occupational therapy can be used for in our Medicaid benefit. So without changing that significantly, we really need to think about how we can be more creative around doing team-based care and reimbursing for team-based care, as opposed to reimbursing through the fee-for-service program, right? So Bailey, I want to set some expectations that is not currently, as far as I understand, if you're explaining things correctly, that's not currently within our benefit, but that doesn't mean that we can't try to come up with these kind of, this is what value-based payment is for. This is why you pay for outcomes and not for individual services. Because to me, multidisciplinary teams, and specifically OT for folks, is so important to help them understand how to not just get healthy, but stay healthy.
Thank you.
Thank you all. And now we have Andrew Rose, and then we're going to go with Linda. And after that, I think for everyone here, we have time for about one more question. So take it away, Andrew.
I appreciate a second bite at the apple here. And Dr. Medlock, as you understand, the network adequacy is really the driving concept in network size. And we've seen RAE contracts specify a network of one provider for every 1,800 people, which is a lower ratio than the worst provider to member ratio in the country, which is Alabama at 1 per 1,100. I know the BHA'S process and also the RAE process are both going to involve network adequacy concepts. In the age of telehealth, I certainly can provide care to any corner of Colorado. And I wonder if you have a kind of bird's eye view about network adequacy and how we can really push the BHA'S and the RAE structure to comply with network adequacy and come up with a definition of network adequacy that really does create a mental health system that works.
Well, I think there's a two-part answer, and then Kristen, feel free to follow me. So first of all, I want to acknowledge for the public that we are more than 2 years away from initiating what you're calling BHA'S, which are the Behavioral Health Administrative Services Organizations. We have, however, posted a request for proposal on entities that can propose a strategy for Colorado to implement that BHA'S structure. And so we are planning now for that process that is actually 2 years from now. So do want to acknowledge that. I spoke in the chat about our access to care methodology and how we'll be the first state to deploy such a methodology. It includes some of the metrics that you're talking about around utilization, a fancy term called provider penetration, those types of things. But I want to focus for the public on something that I think gets to the heart of the issue, is that when you have seen someone who is saying they are a behavioral health healer or provider of services, would you recommend that person to someone you care about? And we're going to start directly asking that question to those who have been in care. That's what we're calling our Net Promoter Score. It's been validated across industry for really being a meaningful metric for actually determining, do we have an effective system? Kristen, what would you add to that response?
Andrew, thank you for, Mr. Rose, thank you for bringing that to that question forward. I do think that network adequacy is really important, and we do expect to align with the BHA on updating our network adequacy standards. So that is an expectation of our partnership together. And if you have any information about all of the states' network adequacy numbers, I'd love to hear it, because I'm in the process of researching it and I'm having to reach out to other Medicaid directors in other states to get those numbers. So if you have some of that research, we'd love to see it, because that is already part of what we're looking to update.
Thank you. And now we have Linda, and time for one more if anyone out there would like to raise their hands. And Linda, feel free to come off mute or chat with us in the chat.
First of all, thank you, Kristen, because recently Medicaid has started with contracting with the school districts, so that those of us that are dual licensed, like I'm a nationally certified school psychologist, but I'm also a licensed professional counselor through DORA, are able to get reimbursed. And that has been a tremendous help in promoting what we are trained to do, which is trauma-informed care, and then also provide grief. And as I said in the chat, frequently we're the front line with the birth to 21 crowd. Those of us that work in the schools, whether it's K-12 or higher ed, we see them on a regular basis and see them first thing. So I really appreciate Medicaid doing that. My next question is a follow-up to that, Dr. Medlock. So what is the plan to coordinate with both your public schools, private schools, charters, and higher education on the care for people going forward? Because I said lots of times we'll see them before they get into any other system.
Thanks for the question, Linda. Is our senior advisor for children still on the line? I want her to be able to share a bit of her vision. Okay, she had to step away. The BHA model for government is that we will work cross-agency, including with the Department of Education, Department of Higher Education, to realize this holistic vision. So initially, we are launching our formal agreements with HCPUP and the Department of Public Health. Next, we are moving into the educational realm. So I want to assure you, Linda, that as our senior advisor for children is onboarding, we are focused on improving school-based mental health. I will say that obviously one of our immediate goals is, again, to be sure that kids have meaningful access to crisis services. Our team, I think we have some of our crisis team on the line. One of the things we're hoping to receive grant dollars to pilot is having a child-focused crisis team for the state, and also piloting a tribal-focused crisis team. So yes, we absolutely are with you on that, and we can say more when our senior advisor for children fully on board.
Anyone else out there who would like to raise their hand and ask a question to our team? Going once, going twice, going 3 times. All right. Wonderful. So thank you all for your questions and engaging in that powerful conversation we had. The Q&A session is now closed. And I do want to say before we get into our next very fun part of this event, that any follow-up questions, please reach out to me, Media Manager Stephanie Bush. My contact information, I will drop it in my chat in the email. My information is also on our new website that I will drop in the chat here.